Great to connect. Excited to have you on the podcast here today. I think, just to kick off, would love, Sentari, for you to share a little bit about your background and your role at evolvedMD and just learn a little bit how you found the company and got started.
Yeah, so Sentari Minor, Chief of Staff and Head of Investor Relations at evolvedMD. I've been with the company for about 4 years. Yes, 4 years. And I fit so story is interesting in that prior to evolvedMD, I ran a kind of a CEO consortium now called Alder. So I worked with purposeful CEOs in Phoenix, where evolvedMD is based, and where I'm from, Dallas and San Francisco. So I went across the three markets for about 3 years and really working with CEOs and kind of figuring out like social and political impact that they can make personally and in their businesses. And one of the CEOs I worked with in Phoenix was Eric Oslin, the CEO of
Hmm.
evolvedMD. So in 20, gosh, when was that? In 2020, we sat down and he's like, "Hey, I'm growing and scaling this company. Would love for someone to come in and one, lead the rebrand, and then two, kind of build out our first strategic plan." And that's what I came in and did. And so I was employee, let's say 7 or 8. And now we're up to 200 employees, and it's been a great journey. And my role has really evolved from there to now really overseeing kind of the office of the CEO, doing everything external relations and internal comms, and then having conversations like this with folks like you.
That sounds like a wonderful run already, being just sh 4 short years, but you packed a lot in there
A
during that
lot.
time. And to go from under 10 employees to 200 is quite a bit of scale. I mean, that's
Yeah.
multiples of growth in a short period of time. Um, for folks that don't know that are listening, talk a little bit about evolvedMD and what you do.
Yeah, so evolvedMD, at the core of our business is we integrate behavioral health into primary care. So we become an embedded resource for large health systems and primary care groups that really want to collaborate on their patients' care. We actually use a model out of the University of Washington Ames Center called Psychiatric Collaborative Care, COCM. And what we've done is really enhance that model so that there's a therapist who works with the primary care provider and the patient, and they collaborate on the care. And then our model actually adds a couple of more elements, including care coordination. So if a patient needs additional resources in the community, we can actually coordinate that care for them. But we are the de facto mental health solution for many primary care groups, and it's been wonderful to see the outcomes and just the immense growth that we've had over the 4 years that I've been involved.
Yeah, that's wonderful. So unpacking that a little bit more, partnering with a lot of hospitals, health systems, touching in-person, remote methods of care. Talk a little bit more about the model there.
Yeah, so at the end of the day, or if you were, let's take you as a patient, Alvin. So you go see your primary care physician. Or provider. And in an ideal world, they would screen you using a PHQ-9 or GAD-7 for anxiety or
Hmm.
depression. So they would go in, they'd screen you for mental health factors, and then say, all right, hey, it seems like you would benefit from seeing a therapist. Now, typically in the traditional system, that therapist would be referred out into the community and they give you a number to call, and then you never actually go see the therapist. In our model, our mental health professionals are embedded in the clinic. So they would say, you should
Hmm.
go see the therapist. And by the way, the therapist is right down the hallway, so they can either get you in right now or you can schedule with them immediately. So it increases access. It also reduces stigma because you're doing it right in your primary care physician's office.
Yep.
It's a place where you're comfortable, and you don't have to go out to a special building to go see a therapist. They're just there where you are. And then also, that therapist works with you on care, and the focus of our model is not to keep you on a panel. It's not to keep you there. It's to get you the skills and resources, the tools you need to thrive and then go on about your life. And so it's a really good kind of short term but very impactful model that we're growing and scaling across the country. And it's uh, one of our unique things, and one of the things that differentiates us is the fact that we lean in person. So we're in person first, and we won a lot of logos that way, and that
Hmm.
we're right there in the office with a primary care provider with the patient. We still see probably about 25 or 30% of our visits virtually because of, well, life, rural areas, whatever it might be. But when we sign a clinic or when we sign a health system, we always make sure that we embed in person first.
Yeah, I love that because I think about 90% of communication can be nonverbal. And obviously,
Yeah.
we sit even now in our podcast, we're doing this virtually versus in person. There's a lot that we get, but kind of the feel, all the senses aren't totally engaged when you're remote. And sometimes people need to feel that closeness, even if it's somewhat psychic or philosophical, at least in my opinion. But I also think that with the pandemic and everything that we experienced in the last half decade, this hybrid model, which you folks employ, even though you prefer in person, that's something that's made a big difference, and it's improved access significantly, especially to
Yes.
folks like you mentioned in rural communities. So I guess one question that I have for you is seeing some of the trends in mental health. Do you continue to see more of a push to in-person therapeutics? Do you think that digital is going to kind of stay where it is? How do you see things shifting going forward?
Yeah, that's a good question. One, I want to call out that I do think digital therapeutics have a place in the ecosystem, right? Like they were great tools, there's great apps, there's virtual therapy exists for a reason and exists for a certain population. I think of the worried well, the Melvins and Centaurs of the world that probably just need like a quick call with a therapist and they'll do fine. But for someone with a little bit higher acuity or more complex needs, in person really, really does work better, at least
Mhm.
from what we've seen. And so I think the trends are one, companies, especially mental health companies, are going to start seeing more folks in person. And I think the market's demanding it. And I think kind of partners are demanding it. I would say two, spots, there will be fewer spot solutions. And I bet fewer spot solutions get funded, like very niche
Yeah.
things that aren't actually increasing access to a larger population. It's being targeted to a specific population, which again, great. But I think if we really truly want to move the needle in providing additional access to mental health, I do believe that our model of integration is the way to go. People really trust their primary care provider, and so providing that access right where they're going to go anyway is so important. I mean, the Biden administration has put so much money behind integration, and rightfully so. And so I think the trend
Mhm.
is more integrated, more in person. I think those were the two things I'd lean towards.
Yeah. And look, clearly that works, right? Because if you went from 7, 8 employees to 200, I'm sure as we think about the years ahead, you want to continue to grow. We're going to see that number continue to increase. There's clearly a place for this type of integrated model. It also seems like it's an easier model to scale in a lot of ways because I would imagine from a payer standpoint, payers want you to have flexibility. You can flex both directions,
We can do,
and
yeah.
it's probably easier to staff as well. A lot of the clinicians and a lot of the areas that you're working. So
And then also our think about our partners. Look, I don't think most people realize that primary care providers, most mental health issues show up in a doctor's office, not in a therapy room. And so our primary care partners are already dealing with this. We get to be the release
mhm,
valve for them. And then also, we've seen it more and more over the last 4 years with the patients in crisis. So they're in their primary care doctor's office. Something happens, they're in crisis. The PCP doesn't know what to do. We are luckily there to de-escalate and do things, and that's really hard to do if there's you on a laptop versus you as the person being in the room de-escalating the situation. And when I first started, that was not rare, but like not as uncommon. But now that's something that's happening weekly in the clinics that we see that our people have to physically de-escalate someone because it's happening in primary care. And so that's where I like this model of in person is the way to go.
yeah, I mean, you think about crisis stabilization and different types of care modalities like PHP and IOP and some of the more higher acuity kind of substance abuse disorder situations where you really do need that person-to-person connection. I think you hit the nail on the head there. There's no way you're going to be able to get away with doing some of that stuff digitally, and there's obviously a place for inpatient as well. But I think overall, one of the things that we've noticed over the past few years, from an investment standpoint, is more and more people have been trying to, let's call it, fill out the care modalities across the spectrum of care. Some obviously you're seeing a little more attention than others. But to your point, because of some of the higher acuity episodes, and I think the opportunity there has been a lot more attention. And
Yep.
thinking about what you said earlier too, what what lessons would you have for other, and I consider you, even though you're part of this larger company, you're an entrepreneur, you're certainly an executive. What lessons would you have for mental health care providers out there that might have that 10-person company today that want to scale? What lessons do you have for them to kind of grow and to get there?
Dude, that's a really good question. I wish I could have been more thoughtful about this. I think one, really invest in I think one, really think about how you want to invest in your people. We've built a really great culture at evolvedMD, and we've been able to grow and scale because we have put intentional investments in our people. Whereas I think maybe, and I don't know this for sure, but some competitors would say like we're not going to pay this or do this and for these for our staff, and we do. And we've since day one said like our mission is the most important part of the work that we do, so we have to take care of them. So really on the front end, putting the money in, investing in your people, and being thoughtful about the culture of the organization. I think that would be number one. And number two, understand, I think for us, really, we didn't have a big marketing budget at the beginning of what we did. So what I came in is that let's lead into thought leadership. So
Mhm.
we have this model. We're really good at it. We haven't fully proven it out, but we're getting there. So let's parallel path. How do we talk about us being the experts in this? How do we get some big wins? And I think that was a big piece. Is like thought leadership in marketing goes a long way. I would say that. And then three, be really intentional about the executive team that you hire, like the people that are going to take this organization forward. Like be the first like 10 or 20 people are really important. So be super diligent about who you bring on. Make sure that they're a culture fit. Make sure that they align with your values. I think those would be like the lessons I would give if someone were sitting across from me right now.
I like what you said there about intentionality around the team and then how that leads into investing in people, especially the first few folks, because the first 5, 10, 15, 20, 25 people, they're going to set the culture for everyone else that comes after. So the people that they end up managing as they progress throughout an organization, um, the biggest companies struggle with culture a lot. And not a behavioral healthcare example, but think about a company like Boeing, used to be the darling of aerospace and
Used to be the
defense.
exemplar, and then they bring in a leader that doesn't care as much, and the company or the culture just goes to crap. Yeah, they used to be the best, and then you can see how people mess that up.
Yeah, a mentor of mine used to say the wolf sets the pace of the pack. And I think about your point there in scaling a business. It's so important. And it helps you to make the right investments in people by having that right team. And all of these other decisions come a lot easier when folks act with integrity. They have the best interests of their people in mind. That seems like something that you guys did. And when you do that, ends up at being a great outcome for stakeholders, but most importantly, the service, the folks you're trying to service, like the patient
Thinking about like
themselves. So
how we've been able to accomplish what we've accomplished in such a short time, and we're a very capital efficient company. I would say it's truly a testament to the leadership, and certainly I'm a small part of that. But it's easier to make decisions when you know everyone around you's values align. It's easier to make decisions and even hard decisions when you trust everyone around you. And so,
mhm.
building out that team that's going to grow and scale the company is so important.